Hello, everyone, and welcome. We will be starting in about 2 minutes. Just want to give everybody an opportunity to get settled and get logged on. Again, for those that are just joining us, we will be starting in about 1 minute. Welcome, everyone. All right, we're going to get started, so welcome, everyone. My name is Tom McDermott, and I'm the Regional Resource Director for Greater Pennsylvania and Ohio at Caron Treatment Centers. Thank you for joining us today for today's webinar on the topic Behavioral Health and Wellness for the LGBTQIA Plus community. As a reminder, we will be conducting this session in webinar format, meaning, whoops, hold on one sec. Sorry about that. Meaning that all participant microphones will be muted. We will not be able to see or hear you. During the presentation, please utilize the question and answer or chat features to ask any questions. Depending upon the volume of questions, if we can't get to your question before the end of the hour, we will have someone from our team follow up with you. Today's presentation is eligible for 1 continuing education credit. We would like to thank our educational partner, CE Learning Systems, for assisting in providing these credits through co-sponsorship with the American Psychological Association. Please note that in order to receive your credits, you will need to complete the post-webinar evaluation. A link will be emailed to you directly after the presentation from cego.com. After finishing the evaluation, you will have immediate access to your certification. So before we get started, I just wanted to share a little bit that we're doing this webinar in honor of Pride, and June is, as most people know, is Pride Month. And just a little quick history of Pride, which started in June of 1969 with the Stonewall protest riots, and basically Stonewall was a LGBTQIA bar located in New York. And the police raided it on a regular basis, and the patrons would be arrested and put in jail, and their names would be published in the newspaper. And during, I believe it was June 28th, the patrons had enough, and they fought back, and the protest and rioting lasted a couple of days. And this was really one of the first times where this community came together to say we're not going to take this anymore. And so the following year, it was organized, and the first Pride parade took place in New York. And that was the start of Pride parades, and they're all over the United States today, which truly makes my heart warm. And even though the Pride festivals, parades, marches are an opportunity for celebration, they are still a protest against unjust systems and allows for a safe space so people can celebrate who they are. I've been at Caron Treatment Centers for 18 years, and back in the mid-1980s, Caron started HIV retreats for the LGBTQIA community. Father Bill, who was an amazing individual that worked at Caron for many years, saw that this community was hurting. So here we had folks that were HIV positive, some were dying of AIDS, in recovery, and they needed a safe place. And we still have these retreats today. So I just wanted to put out there before we have this presentation, first of all, it is Pride Month for June, and that Caron has been creating a safe place for this community since the 1980s. Bethany, if you could change the slide, that would be great. So today I'm proud to introduce our presenters, Bethany Franklin and Cheryl Nepper. Bethany is a family therapist providing individual and group therapy, family therapy, and education. She is also a therapist in Caron, Pennsylvania's LGBTQIA Plus track. Bethany joined Caron in 2017, first as a therapist in the men's program and then the opioid treatment program in 2018. She now supports family members as a member of the Family Services team. Bethany is a licensed clinical social worker and certified advanced alcohol and drug counselor. She is also trained as a rainbow advocate and educator through ITAP. She is a Master's of Social Work and a Master's of Education in Human Sexuality, both from Widener University in Chester, Pennsylvania. Bethany also has a Bachelor of Science in Psychology from the University of Pittsburgh. Cheryl Nepper is our second presenter and oversees the growth and management of breakthrough programming, recreation and wellness services and programs, family services, art and music therapy, and clinical projects. Cheryl has held many key clinical leadership roles at Caron, helping to design Caron, Pennsylvania's core and signature model and developing new programming. Most recently, she served as Senior Vice President of Core Programming. She has worked extensively in the field of behavioral health since 1986. Cheryl is a master's level licensed professional counselor, a board certified art therapist, a certified advanced alcohol and drug counselor, a certified sex addiction therapist and supervisor, and a certified multiple addictions therapist supervisor. Cheryl is professionally trained in dialectic behavioral therapy, motivational interviewing, and 12-step facilitation. Bethany will now get us started. Thanks for joining us today, Bethany and Cheryl.
Thank you, Tom. Good afternoon, everybody. So a few learning objectives for today's presentation. The first is to develop an understanding of LGBTQIA plus terminology. We're going to talk about the LISTEN model and how that can help when working with this population, and then develop an understanding of the treatment needs for the LGBTQIA plus community. So in looking at the acronym LGBTQIA+, just look at how many letters of this acronym that you think you can identify. And obviously, the acronym that you see here on the screen isn't completely all-inclusive of all of the letters of sexual orientations and gender identities that are possible. So the examples here are just a few examples from the acronym. So we'll go through those a little bit more. Lesbian, that is for a woman that is attracted to women. Gay, men attracted to men. Bisexual is when either a man or a woman is attracted to both men and women. Transgender is when someone's sex assigned at birth is not congruent with their gender identity. And then intersex, we typically get a lot of questions on what does intersex mean. So that would mean that someone is born with either ambiguous genitalia or that their chromosomal DNA is not congruent with the external genitalia that was seen when they were born. Asexual is for anyone who is not sexually attracted to any gender. And then queer used to be used in a derogatory sense, but it's now been a reclaimed word for basically anyone that identifies as part of this community, but doesn't feel that they completely fit into one category or another. So that's kind of a catch-all for some folks that use that. So when talking about why is it important to pay attention to the mental health and substance use disorder needs of this community, it's important to look at some of the statistics. So what we're seeing is that individuals that identify as part of this community, there tends to be over time more and more individuals identifying in. And that could be because of society being more accepting, more inclusive, that individuals are more willing to identify. So in 2021, 7.1% of the United States population identified as being part of the LGBTQIA plus community. And that's a big jump from 2012, when only 3.5% identified as being part of this community. So a few more statistics, and I won't read through all of them, but I'll highlight a few of the really key ones here. So LGBTQIA plus adults are more than twice as likely to develop a mental health condition. And transgender individuals are more than 4 times likely to develop a mental health condition. And with that, substance use disorders, LGBTQIA plus individuals are more than twice as likely to use illicit substances and almost twice as likely to end up developing a substance use disorder. And the other thing that I really want to point out as part of this slide is that the LGBTQIA plus community is one of the most targeted groups for hate crimes in the United States. And that really speaks to some of the experiences that members of this community have, some of the trauma that we might be working with. So it's just really important to highlight some of those things as we move forward and we talk about the importance of working with this community. So why are LGBTQIA plus individuals more susceptible to behavioral health and substance use disorders? So a few key things here. Stigma and discrimination really come into play. There are people who still believe that if they're friends with someone who's gay, they'll end up gay. Or if their child watches a TV show with LGBTQ characters, their child will end up being part of the community. So there's a lot of stigma and discrimination that these individuals face. Prejudice, denial of civil and human rights. In some states, it's still legal to deny services to someone part of this community. You might go to a restaurant and be denied access to dine there if your sexual orientation is not heterosexual or if you're transgender. Harassment and bullying. We see a lot, especially in LGBTQIA plus youth. A lot of youth are bullied in school. Sometimes they're rejected by their family members when they start to come out. And family rejection we see quite often. Sometimes individuals are led to be homeless when they come out. Their families aren't accepting of them. Family members might continue to make homophobic or transphobic comments, leading the individual to distance themselves from their family a little bit. And then we have internalized homophobia and internalized transphobia. And what that really means is that when we get messages over time, either as children or continuing into adulthood, that being something other than heterosexual is not okay, when we get messages that it's dirty or it's wrong or it's morally not acceptable, we start to internalize some of those messages. And people who struggle with internalized homophobia or internalized transphobia tend to start to try to fight their sexual orientation or their gender identity. They start to not be as accepting of it. And they basically go ahead and try to really fight who they are. And that can lead to a lot of problems in relating to others, not accepting of oneself. So all of those factors, the bullying, the discrimination, harassment, family rejection, that leads to a lot of individuals to isolate. And what we know about addiction is that it is a disease of isolation. Isolation is very dangerous when it comes to addiction. So for a lot of these individuals who have experienced many adverse events as a result of their sexuality or gender identity, they tend to isolate. And isolation leads to a lot of depression or mental health issues. It can exacerbate trauma symptoms, lead to a lot of anxiety. And what we see is that individuals who isolate and start to distance themselves from loved ones or peers They have trouble supporting healthy relationships. They have trouble maintaining them, and also have some trouble in building healthy relationships. The risk of developing a substance use disorder also increases, and the risk of developing a process addiction and addiction interaction disorder also increases. And what we mean by process addictions, these are addictions that aren't chemical. So it might be a gambling addiction, a sex addiction, a shopping addiction, whatever it may be. And when we introduce chemical addictions into that, we have this addiction interaction phenomenon that comes into play, where the process addiction and the chemical addiction really interact with one another. What we saw during the pandemic, at the beginning of the pandemic, was that a lot of people across the country were isolating, in part because we had to. And this really took a toll on the LGBTQIA plus community, a community that already has a tendency to isolate and now is being forced into isolation, which exacerbated some of the mental health symptoms and exacerbated some of the risks for developing a substance use disorder. So this is the gender unicorn, and I think this breaks down a little bit some of the differences between sexual orientation and gender identity. So starting in the middle section there, where it says sex assigned at birth. So the sex assigned at birth is when a baby is born and the doctor says it's a boy or it's a girl. They make that decision based on the external genitalia, so male or female. But what we also have is a category of intersex individuals. And this is what I mentioned before. So if a child is born with ambiguous genitalia, or maybe they don't have ambiguous genitalia, but they're going through puberty and they're developing secondary sex characteristics that are different than their sex assigned at birth, they might come to realize, and the doctor may diagnose them as being intersex. So separate from sex assigned at birth, we have gender identity. And this is basically an individual's identity if they feel like a man or they feel like a woman. And it exists on a spectrum. So some people might identify as transgender, they might identify as agender or genderqueer. So again, it's really a spectrum and it's separate from that sex assigned at birth. And then we have gender expression. So this is, how does someone express themselves to others? Do they present as more feminine, more masculine based on the clothing they wear or how they do their hair? Some people will present masculine 90% of the time and feminine the other 10% of the time. So again, it really exists on that spectrum. And then we get into sexual orientation. So this is who someone is physically attracted to. So are you attracted to men? Are you attracted to women? Are you attracted to both men and women or all genders? And that's separate from someone's gender identity or sex assigned at birth. And then who are you emotionally attracted to? Again, is it men, women, all genders? So just kind of looking at some of the nuances between what we mean by gender identity, sexual orientation, and sex assigned at birth. So it's also important to talk about cultural competence and cultural humility and what's the difference between the two. So cultural competence is something that a lot of providers have. It's something that we hope they have, and it's really the ability to understand, appreciate, and interact with people from cultures or beliefs different from their own. But then in contrast, we also have cultural humility. And cultural humility really takes on that stance of not being an expert in someone else's culture. So it's an interpersonal outlook that is other-oriented and respectful of an individual's background, regardless of their culture and their experiences. But again, we're not taking that expert stance. So it's important to incorporate that in our practice as well. Culturally sensitive treatment. So when you have a client that's looking for treatment or they're in treatment, maybe they're going through the intake process, it's important to keep in mind some aspects of treatment which make it culturally sensitive and inclusive. So we want to be mindful of the intersection between culture and sexuality. So this could look different for everybody. It might be religion that's impacting someone's sexuality or vice versa. It could be socioeconomic status, race, ethnicity, and just looking at how those things impact one another and intersect. We want to meet clients where they're at. If someone's struggling in the coming out process, we're meeting them where they're at. We're not pushing them to come out. We're just simply meeting them where they're at and being a listening ear. We want to make sure that we're voicing respect for the client's values, culture, and different experiences. Again, not taking that stance of the expert and trying to maintain that cultural humility. And treatment plans really need to acknowledge cultural issues and needs, not only regarding sexual orientation and gender identity, but also those factors like what are the needs for the socioeconomic status, what comes into play culturally for race, for ethnicity. Be aware of culturally relevant resources. So if we're going to be recommending books or resources for individuals to read, we want to make sure that they're able to relate to that in a culturally sensitive way. And be aware of the limitations your clients may face. So if they're struggling with trauma symptoms, if they're struggling with the coming out process due to being bullied or harassed, we want to make sure that we're paying attention to some of those limitations. And culturally sensitive assessments. So this is important not only during the intake process, but also during psychosocial assessments and ongoing therapy sessions. As you're getting to know your client, not only do you want to know their sex assigned at birth, what it says on their driver's license or their insurance card, but it's also important to ask how they describe their gender identity and how they describe their sexual orientation. And trying to leave those questions open-ended if possible, because there are so many gender identities and sexual orientations. When we have a checkbox, we kind of put people into boxes and categorize them in ways that really aren't appropriate. And how do you express yourself? Not only in terms of your gender identity or your sexual orientation, but how do you express yourself physically, mentally, emotionally? What do you want your therapist to know about you? What are some things as a therapist that I should know about you so that I can better treat you and treat the full client? And paying attention to that culture again. How does your culture influence the situation you're in? How do you think cultural factors influence you and taking that into account? So the listen model, like I said earlier, this is a model that's really helpful in working with clients all over the board, but it's specifically even more helpful in working with clients that are part of the LGBTQIA Plus community. So the L in the listen model stands for listen. So we want to provide a safe environment where the individual can openly express feelings and be heard. And make sure that we're creating this safe space by what we display in our offices. The I stands for imagine. So asking reflective questions, encouraging the client to imagine how their life may be impacted by different choices. The S stands for self-determinism. So providing a supportive and affirming environment, no matter what the individual chooses to do, and doing that without judgment. The T is for trust. So developing a trusting relationship with an open door for communication and questions. E is for empathy. So we want to continue to demonstrate empathy, continue that therapeutic rapport and compassion for the individual struggles, pain, confusion, anything that they may have been through in their lives. N is for next steps. So taking an active role in supporting next steps. If you're going to be recommending healthcare providers that are LGBTQIA plus informed, if you're going to be recommending support groups or different books for them to read. So I'll now turn it over to Cheryl for our next section.
Good afternoon, everybody, and thank you for being here. Nice job, Bethany. I'm going to present on the treatment and recovery for this particular community, and also talk a little bit about family services and also what we are doing here at Caron as an organization. We launched a new track this week specific to the LGBTQIA community. Treatment needs. Bethany has covered several key points along her first part of the presentation. A lot of the treatment needs really start with a thorough assessment and having the individual and family having an opportunity to assess treatment. We, as an organization, not only look at the substance use disorder that the individual has, but we look at their mental health disorder, their spiritual self, their physical self, and their emotional self. So a really good assessment looks at all of that. And being able to access a treatment provider that can look at the whole person is incredibly helpful. The other thing we know about treatment needs is that there needs to be a sense of community and mutual understanding. So when we think about substance use disorders and we think about AA as an example, that's a community that understands one another. There's mutual help within that community. We want to build the same for this particular community. And we have done that here at Caron. We do take our patients off-site for meetings, and that is part of the program that they will experience here. Need for feelings of safety and comfort. That's incredibly important in any of the work you do within treatment. We know that approximately 90% of the individuals that come into treatment are suffering from trauma. Bethany had spoken earlier about some of those trigger points that can create trauma for an individual in this community, and then on top with substance use disorder, those things like stigma. Tom talked about the Pride movement and where it started and how traumatizing that was initially, and being locked up and ridiculed for standing up for yourself and having a voice. So there's many traumas and people have been victimized. So we need to be sensitive to that. And we also have to look at our treatment through a treatment that is trauma informed. Treatment should also include group focused on homophobia, transphobia. Just to stop there, Bethany did mention that a little earlier on. That inner critic, that where we start from, our family of origin pieces, how we've been accepted or how we attach to our loved ones, really has a lot to do with where we move in our life. And the messages that maybe we were given early in our life can also affect us later in life along our journey. Really, when we start to question who we are, what our relationship should be like with others. And also that inner critic sometimes can stand in our way of being healthy. And it really allows for those process addictions to find their way in our lives. And it's also a great place for substance use disorder to find our way. Family and relationship problems also are areas that need to be explored. Some families are very open to their loved one coming out and being honest with them, and they embrace that. But we also know that there's a lot of families that will sit in silence and shame and not be able to want to be involved with their loved one. And as a result, it increases that isolation that Bethany had spoken about, which is also isolation is incredibly dangerous. That's when the individual really goes inside, and oftentimes you'll see a higher rate of substance use disorder. You'll see a higher rate of avoiding family events. You'll see a higher rate of suicide attempts and some completions, obviously, and it can be very devastating. So the work with the family and understanding the family and where they're coming from is important on this journey. For the individual, it's also about them understanding what they may perceive they need from their family and what they're really getting from their family. Relationship problems, that just kind of flows with the whole process as one is starting to self-identify and where do I fit in. Assessing for the LGBTQIA plus inclusive services. What experiences do you have working with this population and this community? I think it's real important to understand your limitations, and if you are a therapist or you are a coach, do you have some experience in this area? And I would say if you don't have experience in this area, then you owe it to yourself to be educated. Here at Caron, we've taken the opportunity of working with ITAP, which is the International Institute of Trauma Addiction Professionals, and they are helping us train our staff as rainbow advocates. And the second leg of that module will be a training for clinical specialists in this area. So for those of you who are working in the treatment field, and this is a population that you are seeing, I'm asking that you really take a look at how you are inclusive in your services and how you are also educated. That specific training or certifications is really what I'm talking about. The other thing I'd say is, do you offer specialty programming, specific programming for these individuals? We're going to talk a little bit about what Caron has launched this week and why we chose to launch specific programming. Does the treatment environment foster an atmosphere of safety, allowing for open sharing? Safety, safety, safety. I can't say it enough. These people have been traumatized. There's a lot of fear. There's a lot of fear that if I share about myself, how is that going to be used against me? How safe am I in treatment, or even walking into an office that others might know treat LGBTQIA plus individuals? So having an open environment that is safe, allowing your environment to be a place of open sharing, really needs to be considered as you lay out your programs. I also want to talk a little bit about addiction just in general. Addiction as a family disease. We know that we see many patients come here to Caron. They're the identified individual in the household or the relationship within the family that has found their way to treatment. But we also know, as we start to work with families, that there may be others who self-diagnose during that process of being educated as a family one about substance use disorder. And really the family is the patient and the patient is the family. We talk about the system around the loved one, and the impact that each individual can have on the loved one who is suffering from this disease. And how can we all heal? Maybe we don't all heal together. We may be on a continuum, but it takes one person to start that healing process, and it can become pretty infectious. And I've seen over and over, both in my own personal life, family members heal and grow beyond what originally brings them into treatment. And family recovery is about each individual healing. We also know that family members oftentimes will walk around on eggshells around their loved one for fear of relapse, for fear that if they leave them alone, something bad is going to happen to them. That also parallels to mental health conditions as well. And we see a lot of dually diagnosed clients along the way. So a lot of family members operate out of fear, they're terrified. And then on top of it, if they have a loved one, who comes out during treatment, it's like, oh, here's another thing I have to deal with. Now, how am I going to manage that? And what is that going to mean for me as a mom, as a dad, as a loved one? How are people going to look at me in my community? So education is so important, and it's the beginning of a process. Families' responses to the patient can play a key role in the relapse process. In working with families, obviously, coming here to Caron, being part of our family education program, they get a lot of great tools. They meet people like Bethany, who do a lot of lectures and educational and experiential opportunities for them to understand the disease of addiction. They also have to understand that relapse is always a potential. Doesn't mean it's always going to happen, but it is always a potential. And what I also say to family members is that as family members, we can relapse. We can relapse in our behaviors and our responses. And those behaviors and responses sometimes can be that inner critic that has been there over and over, maybe in our lives growing up, and how that then transcends itself to our loved one who is in treatment. So being able to understand our role, taking care of ourselves, and having compassion for ourselves is incredibly important on this journey. Recovery can't happen in a vacuum. It can't happen alone. The number one thing we know is that when people come together as a group, there's strength in that. There's hope in that. And every day we may hear that, someone has passed as a result of the disease of addiction. But we also have to celebrate that every day there's a lot of people who find recovery. And recovery is about connection and staying connected. Community support is really important for this population. Support for the LGBTQIA plus individual. Some of those things we recommending is affirming places of worship. The LGBTQIA plus community centers, local support groups and activities. They're really thriving in many communities. I suggest that people check out what you might have locally in your area as a resource, and maybe make a connection there and find out, if you are a therapist, how you can have an alignment with those organizations. LGBTQIA plus health centers. That's a really important one. Oftentimes these individuals do not get the appropriate health care that they need. And through our training at ITAP, we learned a lot about that. We found that to be kind of really shocking, that there's a lot of stigma and fear of the individual actually going and asking for help with any health matter. So being able to be sensitive to that and have health centers that are also sensitive and inclusive. Support for families is also family support groups, LGBTQIA community center support groups. Oftentimes the support groups that you'll find at the community center also often have support groups for family members. There is a national network of LGBTQIA plus family groups, and you can find that information at familyequity.org. Again, building what I call wraparound services for the patient and the family that has support is absolutely a must. Caron's mission. I truly believe, as someone who's been here at Caron for 15 years, that way before I even got here, and Tom can speak to that, and he did through mentioning Father Bill, we have been an open organization, a sensitive organization, and an organization of caring and compassion for the LGBTQIA plus community. God bless Father Bill. He opened his arms and embraced these individuals and would even run a group separate from the regular day-to-day substance use disorder treatment that an individual would get. So our mission has been rich for a lot of years, and our vision moving forward is starting this new track, and with the hopes that it will continue to grow. And how we do that as an organization is really from the beginning being inclusive. Our individuals who come here obviously come here for substance use disorder issues. They will receive substance use disorder programming, but they will also receive LGBTQIA, a specialty track if they self-identify and they're interested. We're not going to push it on them. As Bethany said, it's really about during that assessment, seeing how open they are and how engaged they want to be, and if this is the right time for them to be included. And that's that safe, affirming environment for treatment and healing. Caron also has a beautiful program called Breakthrough. Breakthrough is not a treatment program. It is really a signature program that's been here 20 plus years. Breakthrough is a workshop that is about self-help. We'll work on that inner critic, family of origin issues that might come up within relationships that may stand in the way of emotional sobriety. And it also allows us to specialize workshops for this community as well. As Tom alluded very early on, we had retreats started, I forget how long ago, but I know when I got here 15 years ago that they were happening then. And I know they happened probably before that. And these retreats are still here and much alive and part of Caron's mission. And we'll talk a little more about that. So I wanted to highlight for you our LGBTQIA plus track. I'm incredibly proud of a group that came together. Tom and Bethany are two of the cohorts that are, peers in this group that came together to look at everything from our admissions process to what we do in treatment, to family services, to what should a day in the life of these individuals look like while they're here with us on our campus, to what does aftercare sensitivity look like. And we're really excited to say to all of you that we sit here today with 10 patients identified across our campus who have wanted to be part of the LGBTQIA plus track that opened on Monday, and with great success. We wanted to share with you a little bit about this track and what it looks like. They are included in 3 groups per week. There is a rotating topic within this particular first group, which is life after treatment, spirituality, family and relationships, and pride. We do have a pride meeting that occurs here on campus. Life after treatment is, how do you assimilate back into wherever you're going? If you're going on for further treatment, are you going to someone who's going to understand what you started here at Caron and have good continuity of that process? Do you have the right supports around you as you transition out of treatment? What is life going to look like for you, especially if you came out while you were here at Caron? What is that going to look like after you come out of treatment, and how open are you going to be with others in your life? And how can we help you role play through some of that and be prepared for that? Spirituality. Everybody can define spirituality in a very different way. But what does it say about your spirit and your belief, and how are you going to carry that with you? And ongoing family work and development around relationships is obviously huge. We've also woven into our track individual consults as needed. So for example, we might have a young adult here on our campus who has never come out to their family, really hasn't come out to anybody, and for the first time has said, I've identified and I don't know what to do with this, and I'd really like to talk with somebody. I can tell you that both Bethany and Tom have met with patients from our adolescent young folks to our older adults, and everyone in between age-wise and gender-wise. And these individual consults sometimes are the first time that the individual is actually sharing about how they're identifying, what their experience has been like, and their fears and their concerns. And so that can really be an incredible place to start for most. And through those consults might lead them to say, yes, I'm willing to be part of this track, or yes, I'm willing, Bethany, to be part of a family session here while I'm in treatment in a safe place to share with my family, I've identified as gay. Aftercare support is huge. It's huge with any patient that comes to Caron, but we want to be also sensitive that we are matching our patients with the right therapist. That is so important. And I would say, if you're listening today and you are someone who is looking for a treatment provider for yourself, you want to really research a treatment provider that is educated, licensed or credentialed, someone who has experience, someone who has the ability to link you to others if they can't provide that service, and to be able to provide you with also support groups in your area as part of the treatment process. Because I think it's really the building of a network for every individual that leaves treatment here at Caron. And, one of the things I'll also say about us going through the Rainbow Advocate Educator and then the clinical specialist piece through ITAP is it really allows us to be connected to other providers throughout the nation and internationally who have also gone through this specific training. They're not the only person who does training in the country, but they are the group that we have associated with to get some training for our clinical programs here. But aftercare support everyone should have that when they leave a residential treatment facility or outpatient ongoing. We also have a monthly alumni group. It's, very rich. People get together after they leave treatment. They also stay connected once they leave treatment through our alumni group and activities. Those have, a life of their own. Caron also has regional offices, and at many of our regional offices are a lot of alumni events. Also, if you could just take a little time, I'm not going to go through everything, but just the example of the week A, B, C, and D is a rotation of the activities that our individuals are going to engage in. I want to talk a little bit about Breakthrough Workshop. We're pretty excited. Again, June being Pride Month, the launching of our program. We also are launching this month on the week of June 16th, and we only have 4 slots left, 4 or 5 slots left in our LGBTQIA Plus retreat that we're going to be doing at Breakthrough. So if you are interested in attending that, please call our admissions at 800-678-2332 and ask for Breakthrough admissions. And the week of June 16th, we are hoping that week to be able to have a group of individuals that are there. They want to work on their inner critic. They want to work on their relationships. They want to build healthy boundaries for themselves. They want to take a look at any grief and loss issues that they may have experienced. It's really about affirming and supporting, looking at self-esteem and self-worth. And I'm not going to go through everything I have listed there. The hallmark of Breakthrough as a workshop is it is usually a 5-day intensive workshop. Folks come here to Caron. They partake in living here on campus, not in the treatment side of our campus here in Wernersville, Pennsylvania. But we have a separate place of residence for these individuals to stay for 5 days. They come in on a Monday, they leave on a Friday afternoon. And each of those days is helping them build resilience, taking a look at relationships, finding emotional sobriety, and developing healthy boundaries and in your relationships. And we do it through a variety of experiential therapies. Everybody who's ever gone through Breakthrough, the one thing I keep hearing over and over is it was life-changing. Life-changing. We do screen the individuals that come to our program. We want to make sure you're right and ready for this. So that would be part of the assessment process. We do a lot of experiential therapy. So we will use art therapy. We will use movement therapy. We will use mindfulness practice. We do a lot of psychodrama. We do a lot of sculpting, where you may look at the different parts of the roles that you play in your life or others who have affected you as an individual, those in your life, especially those family of origin pieces that come up and sometimes stand in our way of being a healthy individual. We really look at being able to reduce stress and find ways to reduce stress, and really to find acceptance and commitment, above all, to yourself. It's really a supportive and empowering week. The group gels. It can be very exhausting by the end of the week, but people generally leave us and they come back for a refresher. We continue to want to grow our refreshers. And we're also looking to have the LGBTQIA Plus Breakthrough specific workshop offered 4 times a year. And if you're interested in anything related to Breakthrough, you can also go to our website under Breakthrough and take a look at what we are currently offering. So what we've enclosed also for you are citations based on this presentation. And we hope that you have found this incredibly helpful. Both Bethany and I are going to remain. We're going to pass it over to Tom. And any questions that you may have, and I know we have a few that have popped up here during the presentation and prior to us even launching the presentation, and we'd like to answer those for you.
Thank you, Bethany and Cheryl. That was fantastic. And we do have some questions, so why don't we get right to it? So I'm going to ask Bethany. Somebody asked, what does genderqueer mean?
So genderqueer is basically if someone doesn't identify as a man or a woman, maybe they identify as both a man and a woman. And they might not feel comfortable using the term transgender. So it's kind of, a catch-all for someone who identifies as queer. Maybe their gender doesn't match with their sex assigned at birth. Maybe one day they wear feminine clothing and the next day they wear masculine clothing. Maybe they wear a dress and have a beard. So, that's really what we mean by genderqueer.
Perfect. Thank you. This one's for you, Cheryl. On one of the slides mentioned process addiction and AID. One of the participants was wondering, could you go a little bit deeper into exactly what that means?
Sure.
So process addiction are behavioral addictions, such as gambling, sex addiction, food addiction. A lot of those process behaviors also can manifest themselves in folks who have substance use disorders. And the reason being is that the brain is hardwired already for addiction. And these other compulsive behaviors, which can become very compulsive, can kind of come in and become addictive in nature. Where we often see the overlap with addiction interaction is when we have someone who comes into treatment who has a substance use disorder and say they've also been gambling. They come in for substance use disorder, they're gambling at the same time, and now the substance use disorder, they're no longer using their substances, and they identify that they have a gambling problem. We will assess them through the SOGS, the South Oaks Gambling Screen. We also have folks here on campus that are certified in that area who will assess that. We're going to educate them about how these two addictive processes can interact with one another. So for example, it's really about taking care of the whole person. So for example, if I no longer am using my substance and I leave Caron and I have a gambling addiction and I go out and now I substitute or replace the behavior, not my drinking, but I go full force now to self-soothe through gambling. It's just a matter of time where the gambling takes off and becomes very addictive in nature. And it'll be a short period of time back, I'll probably relapse into my substance use. So they really work hand in hand, which is why we call it interaction. And what we try to do here at Caron is to educate patients that there are a lot of behaviors that we have in our lives that can be compulsive. And it's really about finding a healthy balance.
Thank you. So this is a two-part question. So who can access the LGBTQIA track, and do those clients also blend in with the other programs as well?
Yes, so any patient that's here in inpatient treatment at Caron is able to access the track. So when we do our assessment process, we find out about gender identity, sexual orientation, and if it seems that they're appropriate to fit into the track based on those identities and orientation, we will have a conversation with them about the track and if it's something that they would be interested in. And then that's the way that they get put in it. So you have to be a patient here at inpatient treatment at Caron. But the individuals that are in the track also live on their own individual treatment unit. So they might be part of relapse men's program or women's primary program, and they'll still go to their groups, their lectures with that unit, but they'll also attend the specialty track groups that we have as well.
Thank you. So what are some strategies for working with families of LGBTQIA plus youth whose parents are not LGBTQIA affirming?
That is a loaded question.
That's why I asked it.
You know, the first thing I always say is when someone comes here to Caron, most of the family members that come here are like new to the world of substance use disorder when it comes to their children. They've known there have been a lot of behaviors happening, and they may have even seen, you know, some changes in the way they've been identifying themselves as well, through their dress, through their who they're hanging around with, who they might even be on websites with, as it relates to their gender. It's really about education. And the first thing is really to educate them about substance use disorder. And if the patient is ready and the family is ready for discussion around your loved one has identified as lesbian, gay, LGBTQIA, and everybody is open to talking about that, then we will have a session and go that direction. I think it's also important to pace yourself in terms of how much you're going to share information with individuals. Now, I know family members of teens, they want to know everything that's happening with their loved one. And I think we also have to respect that that individual may not be ready to share with their family their sexual orientation. But what we're going to do is educate them, and the ultimate goal is to allow the patient to find comfort to share that with their family. Really, it's not the therapist's job to rush and run in there and say, hey, mom, hey, dad, you know, I met with your son today and he identified as gay. He's not had any partners yet, but he's identifying as gay. And we just wanted you to know that. We really want to empower the patient to be able to find their voice around that. And again, it's really about education. It's about helping the family find some form of acceptance. And this is not something that's going to, that magically overnight is going to resonate easily with some family members. It's going to be a process, and it's going to take some time. I think it's also about us educating families about the disease of addiction and isolation, and how also this population feels a sense of isolation based on stigma, based on fear, based on any traumas that they may have had. So a thorough assessment, a lot of education, and a process, not a quick fix.
Thank you, Cheryl. So here's another kind of loaded question. How do we clinically manage patients who are uncomfortable with an LGBTQIA patient, especially if they're in the same community?
So I would say that, again, a lot of education needs to occur, and patients have the right to have their own beliefs. But we need to make sure that we're keeping the patients who identify as part of the LGBTQIA plus community, that we're keeping them safe, right? So a patient is entitled to their belief, but it doesn't mean that they can make inappropriate comments or make the individual feel unsafe physically or mentally. So again, that's one of those things where we need to continue to provide education to the treatment unit, while we're also not singling out the individual that identifies into the LGBTQIA plus community. But making sure that we're providing that education and ultimately making it a safe space. And if we need to move a patient off the unit, we will certainly do so that the individual's unit can be safe and inclusive.
And just to add to that one, if I may, these are opportunities during treatment team meeting for the multidisciplinary team to also talk through what is it we're going to do if we're finding that is happening on a treatment unit. That providing a safe place is incredibly important to us here at Caron and for the individual. We're not going to tolerate bullying. We're not going to tolerate any bashing. Obviously, that would make a very unsafe situation. If that were to persist and continue, then we have to look at, you know, what does that mean for the individual who's being insensitive? And there's a lot of work that has to be done with that individual as well. Okay. So that whole bullying piece is something we take very seriously and also will address with the individual that may be targeting somebody. So we're quickly on top of those behaviors and try to work as an entire team around those points that Bethany just mentioned.
Thank you both so much. Bethany, if you could change the slide real quick, that would be great. Greatly appreciate the informative presentation, and to all of our attendees for joining us today. As a reminder, this presentation is eligible for 1 continuing education credit. Watch for your email for a link from cego.com to complete your evaluation. If you could change the slide, that'd be great. Caron has several more exciting webinars in the works. Please join us on June 22nd from 12 to 1 for an informative webinar entitled Fentanyl and Its Deadly Consequences, and you can earn 1 CE credit from this webinar. Please visit us at caron.org/webinars for more information to register. In the meantime, please reach out to your local regional resource director at any time for additional information, resources in your area, or questions regarding admissions into any of Caron's programs. Again, thank you for joining us, and happy Pride, everyone.
Thank you, everyone.
Thank you.